I'm gonna be happy, happy today. I'm gonna be happy, happy today.
More than 30% of the population in the UK have not had their regular health checks. We are talking today with Dr. Candy, who will teach us through the process of regular medical health checks. Thank you first of all for seeing us today.
Thank you for having me.
Would you like to talk about your background and tell us what qualifications you have achieved?
Okay, so I am a doctor. I've been working as a doctor for about 15 years. I am dual trained, so I'm trained as a surgeon and also trained as a GP. I stopped my surgical career about five to 7 years ago, and I've been a GP, I think about 7 years now as a GP.
What has inspired you to become a doctor?
Well, actually, it wasn't my first ever career choice. So I was an actual research scientist before I became a doctor. And that's the field that I really wanted to go down. I did my PhD in genetics and was planning to go down that route. But unfortunately, when we were doing the research program, the money ran out. So the money usually is from a research council. Mm-hmm. Sadly, the money ran out. So therefore, I didn't have a job. And at the time, my supervisor and all my colleagues said, I think you should apply for medicine. I think you're better suited to be a doctor than a scientist. So I just applied, and that's how I got into medicine. But it actually wasn't my first choice in terms of career. Since I've been a doctor, it has opened doors for me. So being a GP and being a surgeon, I can go into various different fields. And I can look at work outside of medicine as well, so like education, again research, pharmaceuticals, so it's opened a lot of doors for me from that point of view. In terms of inspiration, I think being a doctor, seeing patients, helping people with their health, that's the inspirational part, the part where someone comes to you with a problem and you have to try and solve the problem, and that's what being a doctor is all about, solving the problem. And I think that's what inspires me to help with all of my patients.
Dr. Candy, I will take you back to the regular health checks now. Mm-hmm. There are many people out there who are not very confident in going to see the doctor about this. They are shy, they are embarrassed, so let's just get a message out there to all those who don't have enough confidence to deal with this moment.
Okay, so health checks are important. They are a guide as to what's going on at the time with your body. It doesn't give us answers, but it can give us clues. There are various health checks that people are listed to. So you've got your national screening programs. So for women, you have the smear screening program. So from the age of 25 to 49, you get a letter from the screening program to go and have your smear test with your GP every 3 years. And then from 50 onwards, it becomes every 5 years. Mm-hmm. Then for women, you also have the breast screening check, if you like, mm-hmm. and that starts from the age of 50. Mm-hmm. So you get an appointment on your 50th birthday to go and have that done, and that's usually a mammogram. So which is basically a scan of your breast to have a look at the breast tissue. Mm-hmm. Now there are other health checks, so you then have your NHS health check, which is a check that you have done every year, and they look at certain parameters, and that's from the age of 40. So you get an invitation from your own GP practice to go and have that done. And they involve your height, your weight, your blood pressure, you'll have some blood tests to check your cholesterol levels and some other parameters. And then from that, it gives us an indication of what your health is like at the time and whether you can do things from a lifestyle point of view or whether you need to start medications to optimize your health. Now for men, there are health checks as well. However, they're not strictly under a screening program. So men can have what we call a PSA test, but they have to have that test if they've got symptoms. There's no guidelines, there's no national screening program for it, but some men have a PSA blood test through their doctor, whether it's through their GP or their urologist, to have it done every year. In terms of having health checks, I think it's really, really important because it is, as I say, a guide of what's happening to your body and your health at the time, and it gives the doctor or the nurse that's carrying out those procedures an understanding of what's happening and where it could lead to if you don't make any changes. It can pick up things as well. So for the smear program, the smear screening, it can pick up abnormal cells. Doesn't say that you've got cancer, but it says that there's something not right with the cells and you need further investigation. With your NHS health check, it could pick up that your blood pressure's high. Now, is it high because you've gone to see a doctor and you're a little bit nervous, or is it high because it's already been high for a while? So does it mean you need medication? Does it mean you need to look at your lifestyle? So it gives us a guide as to what's happening with your body, but it also gives us clues and indications of whether we need to treat or think about what's going to happen in the future.
So we should not ignore the letters
So
when we receive them.
I think if you do receive them, please don't ignore them. Please make the appointment. It is very important, and we are very health conscious at the moment. You know, it's 2023. Everybody's health conscious. You know, people go to the gym, people are losing weight, people are getting private blood tests done and looking at cholesterol levels and various levels in their body. So at the moment, we're a very health conscious society, and I think it's important that if you do receive a letter for a health check or a screening program, that you do follow it up and get it booked in.
What are some of the challenges that you face in your role as a GP?
A very, very hard question to answer. Challenges are patient challenges, doctor challenges, building challenges, space challenges, political challenges, money challenges. It is not one challenge at the moment. It is a mixture of all of those things. We don't have enough doctors. We don't have enough rooms. If we do have enough doctors, we don't have enough rooms to place the doctors in. We don't have enough money to invest in general practice. We don't have enough nurses. We don't have enough admin staff. Politically, you know, they chop and change the contract, so you can do this, you can't do that. So for example, minor surgery is a big thing. GPs used to do minor surgeries up until a couple of years ago, and then that was taken away. So the contract was removed so that GPs can't do them anymore. So we now have patients that come in, for example, with all these cysts and lumps and bumps that they need removing, and sadly we can't remove them. We have to refer them on to the surgeons in the hospital, which increases their workload and pressure for them. Whereas 5 years ago, you know, you could just book an appointment with your GP and get it removed. And that's an example of what challenges we face when we are given limited access to certain things. So I don't think it's not one problem, it's a whole mixture of problems. And sadly, with the mixture of all these problems, it affects patients, it affects the waiting time, that it takes longer for a patient to book an appointment. It frustrates us because I want to see my patients. I want to see, I've started a medication on a patient, I want to see how they are in 2 weeks. I don't want them to wait 6 weeks for my next appointment. I need to know how well it's working, or if it's not working, I need to act sooner if it's not working. So it's a challenge for the patient, but also a challenge for us. And I feel the patients are disadvantaged because of the current circumstances and the situations of the NHS and general practice.
So you would say that the barriers and shortages have gone worse now.
They're worse
in the last few years.
Yes. You know, I would say I've been a GP for 7 years. I think about 7 years. When I started GP 7 years ago, you could get an appointment with your GP within 2 weeks. A routine booked face-to-face appointment within 2 weeks. Now, I think where I work, you're looking at about possibly 4 weeks.
Would you say
possibly
COVID had an impact on this?
COVID had a massive impact with it. Patients were at home for 2 years and they were having obviously health problems. They would save up all of those problems and come and see us. You're restricted with a 10-minute appointment.
Yeah.
You cannot deal with a lot of problems in 10 minutes. So patients book more and more appointments to deal with all of those issues, which reduces the appointments that you can offer. And sadly, it's become a culture now to see your GP for various things rather than go to other places and have try other resources first. So sadly, we are seeing things that could have been dealt with other
By someone else.
by somebody else, other resources, other practitioners.
In your experience, what are the most pressing health concerns at the moment, and how can a GP address them, help us address them?
The biggest that I've seen since COVID is mental health. Without a shadow of doubt, number one is mental health. Mental health has just exploded. Many patients that are at home with mental health issues have then come out the other end, and it's amplified. Their mental health is worse. There are lots of patients out there that have had mental health problems but have never seen anybody about it, and then COVID has heightened it. So I would say the biggest health concern at the moment is mental health. Sadly, the resources available cannot cope with the level of mental health problems we have in society at the moment. As I say, there's no money in mental health. There's reduced number of psychiatrists and psychologists and mental health nurses. They are leaving the profession and going to and choosing other different types of jobs, and sadly, the patients suffer. What we do have is that we do have mental health practitioners, so they're not a psychiatrist or a psychologist or a psychiatric nurse, but these are trained wellbeing healthcare specialists, and they're a stopgap basically. So you would be referred locally to see a wellbeing practitioner as a stopgap in between your referral to go and see the mental health team. And once you go through, you will see this practitioner until you get your appointment, or you see the practitioner until they can help you no more. So therefore, those groups of patients are falling upon the GPs, who are then responsible for their mental health.
Apart from working in a clinic as a GP, you also have your own aesthetic clinic.
I do, yes.
Would you like to tell us a bit about that?
So as you can see, that's my business at the background there. So I have had my aesthetic clinic for the last 7 years, and it's just a little side on from my GP job. It's a very different kind of job, aesthetics, to GP. GP is very pressurised, time pressurised, mind pressurised.
At the moment, what treatments are available at the clinic?
So we have 2 groups of treatments. So the first group is your cosmetic injectables. So we're talking wrinkle relaxing injections, we're talking dermal filler treatments, so anything that you're injecting. And then the other side is skin rejuvenation, so rejuvenating the skin. So microneedling, chemical peels, laser, we've got PRP as well here. And then a whole range of skincare products as well to complement the skin rejuvenation treatments.
Thank you, Dr. Candy.
Thank you very much.
I'm gonna be happy today. I'm gonna be happy